How long does measles take to show symptoms in kids? Imagine catching a virus that spreads faster than you can say infection. That's what happens with measles, a very contagious virus that affects children and adults alike. Knowing when symptoms appear can help catch it early and prevent others from getting sick. So, how long does it take for symptoms to show up after someone is exposed? Let's find out. The time from when a child is exposed to the virus until symptoms start is called the incubation period. For measles, this usually lasts between 7 and 14 days. Sometimes, it can stretch up to 21 days, but most often, symptoms appear within the first 2 weeks. During this incubation period, the person feels perfectly fine and can unknowingly spread the virus to others through coughing or sneezing. Once this period ends, the first signs of measles begin to show. These early symptoms include a high fever that can spike above 104 degrees Fahrenheit, a persistent cough, a runny nose, and red, watery eyes. These symptoms are quite similar to those of a bad cold or flu, which can make early detection tricky. About 2 to 3 days after these initial symptoms start, small white spots called Koplik spots may appear inside the mouth. These spots are a hallmark of measles but are not always visible in every case. They look like tiny grains of white or bluish-white inside the cheeks and are a helpful sign for doctors to diagnose the illness. The most recognizable feature of measles is the rash. Usually, it appears 3 to 5 days after the first symptoms. The rash begins as flat red spots on the face, especially around the hairline and behind the ears. From there, it spreads down to the neck, trunk, arms, and legs. The rash can last from 4 to 7 days and is often accompanied by worsening fever. While many children recover without serious issues, measles can sometimes lead to complications like diarrhea, ear infections, or pneumonia. In rare cases, it can cause more severe problems such as brain inflammation or a neurological disorder called subacute sclerosing panencephalitis, which can develop years later. The best way to prevent measles is through vaccination. The measles vaccine is usually given in 2 doses, one between 12 and 15 months old, and another between 4 and 6 years old. Vaccination is highly effective at preventing infection and its complications. In summary, children exposed to measles typically start showing symptoms between 7 and 14 days after exposure. The initial signs include fever, cough, runny nose, and red eyes, with the rash appearing a few days later. Recognizing these signs early and ensuring children are vaccinated are the best ways to stay safe. If you suspect your child has measles, it's important to consult a healthcare professional promptly for proper care and guidance.